All right. Hi, everyone. My name is Ethan, and for my topic presentation today, I will be again talking about prescription drug abuse. And for my informative speech, I have three goals set in mind for this presentation. The goals are to explain why doctors are not well prepared to prescribe safely, and that there's an abundance of prescription drugs that are being overprescribed and abused, and that we really need to worry about. And finally, to inform you on how to pinpoint the pill pushers and the pill poppers, and how to prevent further damage from occurring caused by these individuals. So, how prepared are doctors to assess our conditions to prescribe and treat accordingly? According to a news report made by CBS News and a report written by Dr. Zachary Meisel, doctors really aren't as confident as they should be in prescribing and treating these patients. Typically, when we go to the doctor and receive prescriptions for drugs for our conditions, we usually think, it's prescribed by the doctor, so it's okay. There's no reason to worry about it. However, Dr. Meisel assures us that this is not always the case. In fact, most of the doctors that are supposed to recognize the addictive and abusive natures of these drugs prescribed uh, don't receive, actually, 40% of them don't receive proper training in med school to assess these types of things. And moreover, 90% can't recognize even possible symptoms of the abuse or abuse of these types of drugs. And the next doctors tend to prescribe with the misconception of the difference between acute and chronic pain. Acute pain being certain things such as, mild knee inflammation, your ankles kind of swelled up a little bit, you might have a little crick in your neck, something like that. But a chronic pain being something like resulting from a traumatic accident, like you broke your leg, you lost your leg, broke your neck, certain things like that. And doctors tend to prescribe with the misconception that that they're saving the patient when they're really actually satisfying them. They're satisfying them by giving them that immediate gratification. Giving them that prescribing them those drugs to give them that immediate gratification, instant healing, for say. So, and also CBS even says that the FDA hasn't provided much help in providing doctors with proper guidelines to follow in order to prescribe these types of drugs, but rather they've actually offered up voluntary educational classes and seminars and webinars in order to reteach them, or I guess update them with this type of information so they understand how to prescribe. However, with them being voluntary, most doctors aren't really showing up for them. So I believe that the FDA ought to make this very mandatory so the doctors are constantly being updated with new prescription methods and guidelines and rules in order to ensure that they're prescribing and treating their patients accordingly. Now, what drugs are we really worrying about? The truth is, we should worry about all of them. Painkillers such as Percocet can be very dangerous due to their addictive nature and the ease of acclimation to the effects of them. So once you're given a prescription for this type of drug, usually over time, if you take it for a long time, your body builds up to an immunity to it and then of course you start building up the immunity and your strength keeps increasing, and then you eventually get to the point where you're at the highest dose that you can get, and it's very, very dangerous, possibly even easy for you to overdose. And then another type of drug would be antidepressants such as Prozac or Effexor are just as dangerous. According to a news reporter, Katie Spencer, 70 million people received antidepressant drugs for treatment in 2018. These drugs are intended to be used for no longer than 9 to 12 months and are decreasing in strength as they go on. However, people have started taking them for extended amounts of time, such as years or decades or such like that, and it's showing that it's causing them to lose any certain brain cells. They legitimately are burning out brain cells over time. Multivitamins are moderately dangerous. However, specifically too much of vitamin A in a single day can be very toxic to the body and even causes organ failure. High blood pressure causes hypertension or stroke actually causes the patient to be at risk of hypertension or stroke if halted. You can take these types of prescriptions like amlodipine or lisinopril for an extended amount of time and not have any problems. However, if the body is halted from these medications, it causes more risk. It causes the blood pressure to skyrocket, and then of course there's risk for hypertension and stroke again. So now that we know a little bit more about the severity of these drugs and the lack of proper prescribing methods, I want to provide ways to pinpoint and prevent such abuse of these drugs. Ways to pinpoint or pinpoint the abusers that are taking excessive amounts of their drugs over a long period of time. They also pinpoint the ones that are unable to stop taking these medications, and despite even their world just completely falling apart. And with your doctors, watch out for those who treat you with medicine rather than finding other ways to treat your conditions. Drugs are not always the way, and they shouldn't be. If anything like this happens, find a way to help their abuser to a rehab center or even warn the pharmacist and the police. Pharmacists, especially, will know more about the drugs, their interactions, and what you can do in order to stop the abuse. Finally, when you are put into a position to take a drug over another treatment for some kind of condition that you might have, ask the doctors if there's another form of treatment. See if there's another way to go about it, so you're not even given the possibility of abusing these types of drugs. And I think that's all for me, guys. These are a few of my sources that I used for this presentation, and that'll be it. Thanks for joining me, and I hope you guys enjoyed. Bye.